Hey everyone, before we get into today's story, drop a comment and let me know where you're watching from and what time it is for you right now. I love seeing where you all are. All right? So today's story comes from Dr. Marcus Rellian, a cardiothoracic surgeon with 20 years of experience. And what he witnessed on March 5th, 2023, it defies everything we understand about life and death. This is a long one. So grab a drink, get comfortable, and let's dive in. In cardiothoracic surgery, there are no gray areas. There's only the clinical, absolute binary state of being. You're either bleeding or you're clotted. Your heart's either beating or it's not. The valve's either open or it's stenosed shut. You're alive or you're dead. My job exists on that binary, and I was damn good at it. For 20 years, I lived in that world. The worlds of certainty, of absolutes. I didn't deal in maybes or what-ifs. I dealt in facts, in data, in the cold, hard reality of human anatomy. I'm a cardiothoracic surgeon. Or, I was. And to me, the human body was a machine. A beautiful, complex, perfectly engineered machine, but a machine nonetheless. The heart, it's a pump. 4 chambers, 4 valves, an electrical conduction system. It has one job: move blood. That's it. And when it breaks, you fix it. You don't pray. You don't hope. You don't cross your fingers and wish real hard. You open the chest. You identify the problem. You repair it. You close. Done. There's a beauty to it, honestly. A perfectly executed suture line, every stitch exactly 2 millimeters apart, tension distributed evenly across the tissue. It's art. Mathematical art. A valve replacement where the prosthetic seats perfectly, no leaks, no gradients. That's not luck. That's skill. That's years of training and thousands of hours of practice. We are mechanics of the highest order. We fix what's broken. We don't guess. We don't hope. We know. At least, that's what I knew. Until March 4th, 2023. The day I met Alara Vaudroy. The day I, a man of science, a man who built his entire career on certainty and absolutes, was forced to confront the impossible. This is the story of the patient who rewrote my medical textbooks. The story that ended my career as I knew it. And the story that I still can't explain. But before I tell you what happened, you need to understand who I was, who I am. Because what I'm about to tell you, it's going to sound insane. It's going to sound like I had a breakdown, or I misremembered, or I'm exaggerating for effect. I'm not. So let me establish something up front. I know what I'm talking about. My name is Dr. Marcus Rellian. I'm 48 years old. I graduated from Johns Hopkins School of Medicine, top 5% of my class. Did my residency in general surgery at Mass General, then a fellowship in cardiothoracic surgery at the Cleveland Clinic. I've been operating on hearts for 20 years. 20 years. I was Chief of Cardiothoracic Surgery at one of the largest academic medical centers in the country. I specialized in high-risk aortic valve replacements, the cases other surgeons wouldn't touch. The 85-year-olds with ejection fractions of 20%. The patients with porcelain aortas where one wrong move and the whole thing shatters like glass. Those were my cases. My elective surgical success rate was 98.7%. That's not me bragging. That's just the number. It's documented. It's peer-reviewed. I've published 47 papers in major surgical journals. I've lectured at conferences in 14 countries. I've trained over 60 residents and fellows, many of whom are now chiefs themselves. I'm telling you this because I need you to understand. I'm not some fresh out of med school resident who panicked during a code. I'm not a nurse who saw something she didn't understand. I've seen everything. Or so I thought. Let me give you some examples. There was the 19-year-old kid. Motorcycle versus semi-truck on I-95. He came into our trauma bay with a traumatic aortic dissection. You know what that means. His aorta, the main artery coming out of his heart, had torn. Ripped open, he was bleeding into his chest cavity. By the time I saw him, he had already gotten 12 units of blood. He was barely hanging on. I opened his chest, and his aorta, it looked like shredded tissue paper, just torn to hell. There was no repair here. This was a complete rebuild. I spent 11 hours in that OR. I replaced a 15-centimeter section of his ascending aorta with a Dacron graft. I had to go on bypass, cool him down to 18 degrees Celsius, stop his heart completely for 45 minutes while I worked. He walked out of the hospital 6 weeks later. That's case number 1. Here's another, a 34-year-old woman, mother of 2. She had severe mitral regurgitation. Her valve wasn't closing right. Blood was leaking backward into her lungs. She'd been putting off surgery for years because she was scared. But finally, she couldn't breathe anymore. So she came to me. We did a mitral valve repair. Textbook case. Should have been routine. Except halfway through, she coded. Right there on the table. V-fib. Her heart just stopped working. We shocked her. Once, nothing. Twice, nothing. 3 times. We brought her back. Then, 20 minutes later, she coded again. We brought her back again. It happened 3 times during that surgery. 3 times her heart gave up. And 3 times we pulled her back from the edge. She's still alive today. Her daughter just graduated from college last year. I got a card. That's case number 2. And here's the thing. I've done impossible before. I've pulled off what other people would call miracles. I've had cases written up in the New England Journal of Medicine. I was the surgeon other surgeons called when they were out of options. So understand this. When I tell you that what happened with Ilara Vaudreuil was impossible, I don't use that word lightly. I've lived in the space between impossible and inevitable for 2 decades. I know the difference. I know what a miracle looks like. And I know what falls outside the realm of medicine entirely. This was the latter. It started 15 years ago. Or maybe it started on March 4th, 2023. Honestly, I don't know anymore. But let me take you back. To New Orleans, 2008. I was a second-year surgical resident at Tulane. Young, arrogant, sleep-deprived, running on caffeine and ego. You know the type. We all were. It was a Friday night. We'd just finished a brutal 30-hour shift. And a few of us, me, 2 other residents, and a med student, we went out. Got some drinks on Bourbon Street. Tried to pretend we were normal people with normal lives for a few hours. We were drunk. Not sloppy, but loose. Laughing too loud. Feeling invincible. And someone, I don't even remember who, suggested we go see a palm reader, for fun, to mock the local color. We were scientists, right? Men of reason. We didn't believe in that stuff. So it'd be funny. We'd go, let some con artist tell us we'd live long lives and marry beautiful women, pay her $20 and leave. That was the plan. There was a place in the French Quarter, down a side street, away from the main tourist traps. A small shop with a hand-painted sign that said, Vaudreuil card readings, by appointment only. But the door was open, and there was a woman sitting inside. Older, maybe 70, maybe 75. Dark skin, silver hair pulled back in a bun. She was shuffling a deck of cards at a small table. One of the guys knocked. She looked up. "Come in," she said. Her voice was quiet, calm. We stumbled in, still laughing. I remember thinking, this is going to be hilarious. She looked at each of us, not smiling, not frowning, just looking. "Who's first?" she asked. The other guy suddenly got shy, backed off. So I said, "Sure, I'll go." I sat down across from her. And here's the thing, I was actively trying to debunk her. I wasn't going to give her anything. No information, no tells. I kept my face neutral, didn't fidget, didn't offer my name or what I did for a living. She didn't ask. She just looked at me. For a long time, maybe 20 seconds. And then she reached across the table and took my hands. Both of them. Palms down, not palms up. Palms down. She turned them over slowly, looked at the backs of my hands, my fingers, my knuckles. And then she said, "These hands will hold hundreds of hearts." I smirked. I thought, okay, here we go. She saw me walk in with the other residents. She's guessing I'm a doctor. But she wasn't done. "You're going to be a great man," she said. "People will respect you, fear you even. You'll save lives. Many, many lives." I rolled my eyes. Classic cold red. Tell the young guy he's going to be successful. Everyone wants to hear that. But then she paused, and her grip on my hands tightened, just a little. "But the heart that will teach you the most," she said, "will be one you cannot fix." I frowned. "It will be the one that fixes itself." Okay. Now she had my attention. That was specific, weird. She let go of my hands, looked me right in the eyes. "And when that day comes," she said, "you'll be angry. Not at the patient, at yourself. Because you'll realize you've been fixing the wrong things all along." The room was quiet. My friends had stopped laughing. I didn't know what to say, so I said nothing. She smiled, just a little. Sad, almost. "That'll be $20. I paid her. We left. And outside on the street, I laughed it off. "Well, that was weird," I said. My friends agreed. We joked about it, made fun of the cryptic fortune teller nonsense. But here's the truth. It bothered me. Not a lot. Just a little. Like a splinter you can't quite dig out. Because how did she know I was a surgeon? How did she know I worked with hearts? I told myself, she guessed. She saw the group of us. Young, confident, probably doctors. She took a shot. It was a cold read. A good one, sure. But still a cold read. The whole thing was statistical probability dressed up as mysticism. And over the next few weeks, I convinced myself of that. I filed it away. Forgot about it, or I thought I did. For 15 years, I didn't think about Alara Vaudreuil. I finished my residency. I became an attending, then chief. I got married, divorced, operated on thousands of patients, published papers, built a career. And that night in New Orleans, it became a funny story I'd tell at dinner parties sometimes. Oh yeah, one time a palm reader told me I'd fix hearts. Wild, right? But I never told anyone the second part. The part about the heart that fixes itself. Because honestly, I didn't remember it. Not consciously. But it was there. Somewhere in the back of my mind. Buried, waiting. And on March 4th, 2023, it came back. March 1st, 2023, it was a Wednesday. I remember because Wednesdays were my OR days. I'd have back-to-back cases from 7 a.m. until sometimes 6 or 7 p.m. I was in my office that morning, reviewing my surgical schedule for the week. Coffee in one hand, scrolling through the electronic medical record with the other. Thursday looked light, just one case. I clicked on it. Patient, Alara Vaudreuil, 87 years old. Diagnosis, severe aortic stenosis. Procedure, TAVR. I stared at the name, Alara Vaudreuil. Something about it. I don't know. It felt familiar, but I couldn't place it. I figured maybe I'd seen her in the clinic before, or maybe she'd been referred by another cardiologist I'd worked with. It's not an uncommon name in Louisiana. Vaudreuil's an old Creole surname. There are probably 100 Vaudreuils in the New Orleans metro area alone. I clicked through her chart, reviewed her imaging. Her echoes showed critical aortic stenosis. Valve area of 0.6 square centimeters. That's bad, really bad. But the case itself, straightforward. She was high risk because of her age, but I'd done this procedure 600 times. This was routine. I closed the chart, finished my coffee, moved on with my day, and I didn't think about it again. Not until I walked into the pre-op bay 2 days later, March 3rd, 2023. 6:30 a.m. The pre-op area was quiet. It always is that early. Just the soft beeping of monitors, the shuffle of nurses prepping patients, the smell of antiseptic, and that weird industrial coffee they keep in the break room. I had my iPad with me. I was reviewing Ilara's imaging one more time before we went into the OR. I always did that. One last look, make sure I didn't miss anything. I walked into Bay 4, and I saw her. She was sitting up in the hospital bed, wearing one of those awful paper gowns that never fit right. IV in her left arm, pulse ox clipped to her finger. She was old. 87, like the chart said. Frail, skin like tissue paper, thin and translucent. Her hair was silver white, pulled back in a loose bun. But her eyes were sharp, dark, knowing. And the second I walked in, she looked at me. Not at my face, at my hands. And I felt it. This cold little spike of something, not quite fear, not quite recognition, just something. She smiled, not a polite, "Oh, hello, doctor," smile. A knowing smile. "Dr. Rellian?" she said. Her voice was quiet, raspy, like dry leaves being dragged across pavement. "It's about time. I've been waiting for you." I stopped. Waiting for me? I forced a smile. Professional, warm but distant. "Good morning, Mrs. Vaudreuil. I'm Dr. Rellian. I'll be performing your valve replacement today." She nodded slowly, still smiling. "I know who you are," she said. "Okay, that's fine. Patients Google their surgeons all the time." She probably looked me up, saw my credentials. My photo on the hospital website, that's normal. But then she said, "The heart that fixes itself, remember?" And everything stopped. The noise in the pre-op bay, the beeping, the murmured conversations, the shuffle of feet. It all just faded. I stared at her. She stared back. "You're going to be angry with me, doctor," she said softly. "But you'll understand. After." My mouth was dry. I opened it to say something. I don't even know what. But before I could, a woman stepped into the bay. "Mama, don't scare the poor man." I turned. The woman was in her early 60s, maybe. African American, like Ilara. Warm brown eyes, graying hair, a kind face. She was holding a purse and a small duffel bag. She walked over to the bed and put a hand on Ilara's shoulder. "I'm Eleanor," she said, looking at me. "Eleanor Vaudreuil. I'm her daughter." I shook her hand, on autopilot. "Dr. Rellian." Eleanor looked down at her mother. "Mama's been saying strange things lately," she said, and I could hear the worry in her voice. "I think she's just nervous about the surgery. You know how it is." "Of course," I said, trying to sound reassuring, trying to sound like a doctor and not like a man who just had the ground shift under his feet. Eleanor leaned closer to me, lowered her voice. "Last night, she told me she was going away for a bit," Eleanor said. I asked her where. She just smiled. Didn't answer. She looked at me, searching my face. "That's just pre-surgical anxiety, right? The anesthesia worries? She's never had surgery before." "It's very common," I said. And it was. Patients say all kinds of things before surgery. They're scared. They think they're going to die. They say goodbye to their families like they're never going to see them again. It's normal. But I looked back at Ilara, and she was still watching me. still smiling that knowing smile. And I felt it again, that cold spike. But I shoved it down, because I'm a surgeon. I don't do superstition, I don't do cryptic warnings, I do medicine. So I pulled up my armor, that professional, clinical, untouchable shell that every surgeon learns to build. "Mrs. Vaudreuil," I said, my voice firm, controlled. "Let's discuss your valve. Aortic stenosis. Let me explain what that is, because you need to understand what we were dealing with. Your aortic valve sits between your heart and your aorta, the main artery that carries blood from your heart to the rest of your body. It's a one-way door. Opens, lets blood out. Closes, keeps blood from flowing backward. Simple, right? Except, over time, that valve can get damaged. It calcifies, hardens. The leaflets, the little flaps that open and close, they get stiff. They don't open all the way anymore. So instead of a nice wide doorway, you've got a narrow crack. And your heart? Your heart has to work harder and harder to push blood through that tiny opening. Eventually, the heart can't keep up. You get symptoms: chest pain, shortness of breath, fainting spells. And then, if you don't fix it, heart failure. And then death. Alara's valve area was 0.6 square centimeters. Normal is 3 to 4. She was living on borrowed time. Without surgery, she had maybe 6 to 12 months. And those months wouldn't be pleasant. She'd be in and out of the hospital, fluid in her lungs, unable to walk across a room without gasping for air. So we do a procedure called a TAVR, transcatheter aortic valve replacement. It's actually pretty amazing. We don't have to crack open the chest. We don't have to stop the heart. We do it all through a tiny incision in the groin. Here's how it works. We go in through the femoral artery, that big artery in your leg. We thread a catheter up through the artery, past the kidneys, past the liver, all the way up to the heart. And at the tip of that catheter is a new valve. It's collapsed down, folded up tight. We guide it through the old calcified valve, and then we deploy it. The new valve expands like a stent. It pushes the old valve out of the way and takes over. The best way I can describe it: imagine threading a collapsible umbrella through a garden hose. And then, once you get it to the right spot, you pop the umbrella open inside a clogged pipe. That's basically a TAVR. Now, Alara was high risk. She was 87, frail. Her kidneys weren't great. Her lungs weren't great. But the alternative was watching her slowly suffocate over the next year. So the risk was worth it. And honestly, this procedure was my bread and butter. I'd done over 600 TAVRs in my career. I'd done them on 90-year-olds. I'd done them on patients with ejection fractions in the teens. I'd done them on people other surgeons wouldn't touch. This was, by all accounts, a routine case. I wasn't worried. March 3rd, 2023, 8:15 a.m., operating room 4. The room was prepped, sterile drapes everywhere, monitors lined up along the wall showing live fluoroscopy, real-time X-ray imaging so we could see exactly where the catheter was going. The anesthesiologist was at the head of the table. 2 scrub nurses, a perfusionist standing by, just in case we needed to go on bypass, a cardiology fellow observing in the corner, and Alara. She was on the table, draped, IV lines running, EKG leads stuck to her chest. Now here's the thing about TAVRs. We don't put patients fully under. We use what's called conscious sedation. They're drowsy, comfortable, but technically awake. It's safer for elderly patients, less risk of complications. So Alara was awake. Sort of. I was scrubbed in, gloved, gowned, standing at her right side where we'd access the femoral artery. "All right, Mrs. Vaudreuil," I said, my voice calm, steady. "We're about to start. You're going to feel a little stick. That's the local anesthetic. After that, you won't feel anything. Just some pressure." She didn't respond. Her eyes were half closed. The sedation was working. I prepped the site. Betadine. Sterile drapes. I was about to make the first incision when her eyes opened. Fully opened. She turned her head, looked directly at me, and she whispered, "See you on the other side, doctor." I froze, just for a second. The scrub nurse glanced at me. I cleared my throat. "You'll be fine, Mrs. Vaudreuil. I'll see you in recovery." She smiled, and then her eyes closed again. I shook it off. Patients say weird things under sedation. It doesn't mean anything. I made the incision. The surgery went perfectly, and I mean perfectly. We prepped the right femoral artery. I inserted the 18 French sheath, basically a big plastic tube that gives us access to the artery. No complications. We threaded the guide wire up through the aorta, across the calcified aortic valve. Smooth passage. No resistance. We did a predilation. That's where we inflate a balloon inside the valve to crack open the calcification, make room for the new valve. The gradient, the pressure difference across the valve, dropped from 60 millimeters of mercury down to 35. Exactly what we wanted. Then we deployed the valve, a 26 millimeter Edwards Sapien 3, the Cadillac of TVR valves. We inflated it slowly, what we call a snowman inflation. 2 stages. First the bottom, then the top. Perfect technique, perfect placement. I watched it on the fluoroscopy screen. The valve expanded, seated itself right in the middle of the old valve. No migration, no tilt. Beautiful. We did a post-deployment angiogram. Injected dye, watched it flow through the new valve. No leak, no regurgitation. Mean gradient across the valve, 8 millimeters of mercury. Textbook. I was about to start removing the catheter when the anesthesiologist spoke up. Marcus, BP's dropping." I looked at the monitor. Blood pressure, 90/50, then 80/40, then 70/30. Shit. The room tensed. You could feel it. That sudden shift from routine to something's wrong. "Push vasopressors," I said. Calm, steady. "And give me a quick ultrasound of the access site." The fellow moved in with the portable ultrasound. Put the probe on Alara's groin. I looked at the screen. There. A small hematoma. A collection of blood at the access site. It was compressing the femoral artery, cutting off the blood flow to her leg. That's why her pressure was dropping. Not a catastrophe, but not great. "I've got it," I said. I repositioned the catheter slightly, pulled it back 1/2 centimeter, and then I put my hand over the access site and pressed. Hard. Manual compression, 30 seconds. I watched the monitor. Blood pressure, 75/35, 80/40, 90/50, 100/60. It stabilized. The hematoma stopped growing. Crisis averted. I let out a breath. "Nice catch," the anesthesiologist said. I nodded. This is what separates good surgeons from great ones. We don't panic. We don't freeze. We identify the problem, and we fix it. That's the job. I finished removing the catheter. We achieved hemostasis, stopped the bleeding, closed the access site with a closure device. Done. Total procedure time, 2 hours, 14 minutes. Post-op, we did an echocardiogram in the OR. Ejection fraction, 55%. Great. The valve was perfectly seated. No leak, no complications. I stripped off my gloves, my gown, walked out of the OR. I'd fixed her. The mechanic had done his job. We transferred Alara to the surgical ICU for recovery. Standard protocol. We'd monitor her overnight, make sure everything stayed stable. Expected discharge in 48 to 72 hours. I went to see her about an hour later. She was awake, sitting up a little in the ICU bed. Eleanor was there, sitting in a chair by the window, holding her mother's hand. "Dr. Rellian." Eleanor stood up when I walked in. "The nurse said it went well." "It went perfectly," I said, and I meant it. "The valve is in. It's working beautifully. Her heart looks great." Eleanor exhaled, relief flooding her face. "Oh, thank God." I looked at Alara. She was watching me, alert, smiling. "How are you feeling, Mrs. Vaudroy?" I asked. "Tired," she said. Her voice was still hoarse, but steady. "But good. Thank you, doctor." I nodded. "You should be. You did great. We'll keep you here overnight, just to monitor things. But if everything stays stable, you'll be home in a couple of days." She reached out, took my hand. Her grip was surprisingly strong. "Beautiful work, doctor," she said softly. "But the real work hasn't started yet." I frowned. "What?" She just smiled, patted my hand, and then she closed her eyes. Eleanor laughed nervously. "She's still a little loopy from the sedation," she said. "Ignore her." "Right," I said. But I didn't ignore her. I couldn't, because I felt it again, that cold spike, that sense of something. But I shook it off, chalked it up to post-sedation confusion. Patients say weird things coming out of anesthesia all the time. It didn't mean anything. I left the ICU, went home, had dinner, a glass of bourbon, went to bed. And I slept fine, because everything was fine. The surgery was a success. Alara Vaudroy was going to be fine, and in 48 hours, she'd go home. That's what I thought. March 4th, 2023, 7 a.m., post-op day 1. I walked into the ICU for morning rounds with my usual coffee. Double shot, black. I had 4 patients to see. Alara was the last one on my list. I walked into her room expecting the usual. Vitals stable. Patient uncomfortable but improving. Ready to transfer to the step-down unit by the end of the day. And that's exactly what I found. She was sitting up in a chair. Not in bed. In a chair. Eleanor was there, chatting with her, showing her something on her phone. They were both smiling. The nurse saw me and gave me a thumbs up. "She's doing great, Dr. Rellian. Vitals have been rock solid all night. No issues." I walked over, did a quick exam, listened to her heart. The new valve sounded perfect. That crisp, mechanical click-click of a prosthetic valve doing its job. "How are you feeling, Mrs. Vaudroy?" "Good," she said. And she sounded it. Her voice was stronger. "A little sore, but good." "That's normal. You're doing beautifully." And she was. This was my success story. I'd done exactly what I was trained to do. Identified the problem, fixed it. Patient improving, textbook. I left the room feeling good, satisfied. That quiet sense of accomplishment you get when a case goes right. I finished my rounds, saw my clinic patients, reviewed imaging for an upcoming case. It was a normal day. And then, at 7 p.m., I was at home. I just sat down with a leftover container of Chinese food and turned on a basketball game when my phone rang. The screen said, "ICU, nurse station." I answered. "Dr. Rellian, it's Amy. I'm the night nurse in the ICU." "Hey, Amy, what's up?" There was a pause. "It's Mrs. Vaudroy. I don't know, she's off." I frowned. "Off how?" "She's really lethargic, more than usual. I mean, I know post-op patients get tired, but I can't quite put my finger on it. Her vitals are stable. Everything looks fine on paper, but she just seems not there." I thought about it. Post-op fatigue is common, especially in elderly patients. The stress of surgery, the anesthesia, the pain meds. It all adds up. They get drowsy, sleep a lot. It's normal. "Has she been responding to you?" I asked. "Yeah, I mean, she opens her eyes when I talk to her." but she just seems really out of it. Okay. Keep an eye on her. Give her some time. She's 87. Her body's been through a lot. Call me if anything changes. All right, will do. I hung up. I wasn't worried. I should have been. March 5th, 2023, 7 a.m. I walked into the hospital the next morning. Same routine, coffee, rounds. But this time, the ICU nurse intercepted me before I even got to Alara's room. Her name was Jessica. She'd been working nights. She looked exhausted and worried. Dr. Rellian, she said, her voice low, urgent. Mrs. Vaudreuil, something's wrong. My stomach dropped. What's going on? She's very lethargic. We've been trying to wake her up for the past hour. Her vitals are stable, but she's just not there. She's not responding. I didn't say anything. Just walked fast toward her room. Jessica followed. Her daughter's been here since 6:30. She's really worried. I pushed open the door, and I saw Eleanor. She was standing at the bedside, leaning over her mother, shaking her shoulder. Mama, she was saying, her voice tight, controlled panic. Mama, wake up, please, please wake up. Alara wasn't moving. I walked in, and I saw it immediately. She wasn't lethargic. She was obtunded. There's a difference, a big one. Lethargic patients are drowsy. They respond when you talk to them, when you touch them. They're just slow. Obtunded patients? They're barely there. They might respond to painful stimuli, but not much else. This was obtunded. Eleanor, I said gently, I need you to step back for a second. Let me take a look. She moved aside. Her hands were shaking. I stepped up to the bed. Alara, I said, my voice loud, firm. Alara, can you hear me? Nothing. No response. Not even a flicker. Mrs. Vaudreuil, can you open your eyes? Nothing. I reached down, took her hand. Can you squeeze my hand? Nothing. Okay. I moved to the next level. I reached across and squeezed her trapezius muscle. Hard. It's right where your neck meets your shoulder. It's full of nerves. It hurts. Patients almost always respond to it. They flinch, they grimace, they try to pull away. I squeezed. Nothing. Not a grimace, not a flinch, not even a reflex withdrawal. And that's when I felt it. The first prickle of, not fear, but discrepancy. Something wasn't right. I pulled out my pen light, leaned over her. Alara, I'm going to shine a light in your eyes. I lifted her eyelid. Shined the light. Her pupils were 4 millimeters, equal, but sluggish. Too sluggish. I moved to the other eye. Same thing. And then I did a sternal rub. You know what that is? You ball up your knuckles and you grind them hard, right into the center of the chest, into the sternum. It's a noxious stimulus. One of the most reliable ways to check if someone's truly unresponsive. Because if you're even a little bit conscious, you react. You grimace. You try to push the hand away. Something. I ground my knuckles into her sternum. Hard. For 5 seconds. Nothing. Not a flinch. Not a twitch. Nothing. I stepped back. Looked at the monitor. Heart rate 45 beats per minute. Sinus bradycardia. Slow but regular. Blood pressure 80/40. Low. Too low. Oxygen saturation 92%. Technically okay, but on the low end of normal. I put my fingers on her carotid artery, checking for a pulse, and I felt it. Barely. It was thready. So thready it felt like a thread of silk being dragged beneath my fingertips. My mind started racing, going through the differential diagnosis, the list of things that could cause this. Stroke? Possible. But her pupils were equal. No obvious facial droop, no lateralizing signs. Hemorrhage? Intracranial bleed? Less likely. She wasn't on blood thinners. but possible. Sepsis, infection, no fever, no elevated white count on her morning labs. Medication error? I mentally reviewed her chart. Standard post-op meds. Nothing that should cause this. Metabolic issue? Electrolyte imbalance? I'd need to check labs, but none of it made sense. This shouldn't be happening. She was fine yesterday, sitting in a chair, talking, smiling. And now, Eleanor's voice broke through my thoughts. Dr. Rellian, what's wrong with her? What's happening? I turned. Her eyes were wide, terrified. I don't know yet, I said, honest. But I'm going to find out. I looked at Jessica. Get me a stat head CT, CBC, CMP blood cultures, and call the rapid. And then I stopped, because I looked at the monitor again, and the heart rate was dropping. 45, 40, 35. Actually, I said, my voice sharp, I'm not calling a rapid response. I walked to the wall, hit the code blue button. Get the crash cart in here, now. The alarm blared, that loud, piercing, impossible to ignore wail that echoes through the entire ICU. Code blue, ICU. Roommate, code blue. I heard feet pounding in the hallway. Eleanor gasped. What's happening? Ma'am, I need you to step outside, Jessica said, already moving toward her, gently guiding her toward the door. But, now please. And then the monitor changed. The alarm. That sharp, insistent thwack, thwack, thwack of the heart rate alarm. I looked up. The rhythm strip at the top of the monitor. Ventricular tachycardia. VTAC. Her heart rate, 180. Fast. Chaotic. The heart wasn't pumping anymore. It was just quivering. Useless. And then, before I could even process it, the rhythm degraded. Ventricular fibrillation. VFib. The heart was no longer beating in any organized way, just a useless, chaotic electrical storm. Eleanor screamed. And then the crash team burst through the door. I didn't think. I moved. I climbed onto the bed, knelt next to Alara, put my hands on her chest, one palm over the other, elbows locked, and I started compressions. 1 and 2 and 3 and 4. I pressed down, hard, at least 2 inches deep. I felt her ribcage crack under my palms. It always does in elderly patients. The cartilage is brittle. It breaks, but you keep going, because broken ribs are better than death. 5 and 6 and 7 and 8. The team flooded in. A resident, 2 nurses, a respiratory therapist with a crash cart. Get the pads on, I said. Still, compressing. Someone bag her. The respiratory therapist moved to the head of the bed, started ventilating her with the ambu bag, squeezing air into her lungs. A nurse ripped open Alara's gown, slapped the defibrillator pads on her chest, one on the right side just below the collarbone, one on the left side, below the breast. The defibrillator started charging, that high-pitched whine. Stop compressions, I said, pulled my hands back. Everyone stepped away from the bed. Clear. I hit the button. Her body jerked, convulsed, arched off the bed. I looked at the monitor. Still VFib. Continue compressions, I said. Back on her chest. Push 1 milligram of epinephrine. Start an amiodarone drip. We were running the ACLS algorithm now. Advanced cardiac life support. It's choreographed. We've all done this 100 times. It's muscle memory, compressions, ventilations, medications, shocks, over and over. 30 compressions, I said, counting out loud. 1 and 2 and 3. The respiratory therapist squeezed the bag twice. 2 breaths. Back to compressions. A nurse pushed the epinephrine. Another was hanging the amiodarone drip. The defibrillator charged again. Clear. Thunk. 300 joules this time. Her body jerked again. I looked at the monitor. Still VFib. Damn it, I muttered. Continue compressions. Second dose of epinephrine. I rotated off compressions. My arms were burning. A second-year resident took over. Strong kid. Good compressions. I stepped back, looked at the monitor. Still V-fib. Shock again, I said. 360 joules. Clear. Thunk. This time, the rhythm changed. For about 3 seconds, the monitor showed a systole. A flat line, and then it snapped back to V-fib. Amiodarone, second dose, I said. Push another milligram of epi. I glanced at the door. Eleanor was outside. I could see her through the small window. A nurse was with her, holding her shoulders. She was sobbing. 20 minutes. We'd been running this code for 20 minutes. Statistically, her chances were nearly zero. After 10 minutes of CPR, survival rates dropped to less than 5%. After 20, less than 1%. But we kept going, because that's the protocol. You run the code until it's obvious there's nothing left to do. Fourth shock, I said. Clear. Thunk. Still V-fib. Fifth shock. Clear. Thunk. And this time, the rhythm changed. Isostole. A flat line. No electrical activity at all. Continue CPR, I said. Push epi. Per protocol, we continue compressions for at least 10 more minutes when the rhythm is asystole. Because sometimes, rarely but sometimes, the heart can restart. But I knew. Deep down, I knew. This wasn't coming back. At 30 minutes, I was back on her chest. The resident had rotated off. He was exhausted, so was I. But I kept going. 1 and 2 and 3. My arms were burning, my shoulders screaming. 4 and 5 and 6. And I was thinking about her words. The heart that fixes itself. 7 and 8 and 9. I was angry. Angry at the memory. Angry at the absurdity of it. She was a con artist, a cold reader. This means nothing. 10 and 11 and 12. Focus. This is science. This is medicine. 13 and 14. She guessed. She got lucky. 15 and 16. But what if she wasn't? I shook my head. Pushed the thought away. Push another round of epi, I said. A nurse did. I kept compressing, and I watched the monitor. Flat line, flat line, flat line. I looked at the clock on the wall. 7:47 a.m. I looked at the monitor. Flat line. I looked at the team. Everyone was drenched in sweat. Hair plastered to foreheads. A nurse in the corner was crying quietly. We'd done everything. 6 rounds of epinephrine, 3 rounds of amiodarone, 8 shocks, 35 minutes of CPR, everything. And it wasn't enough. I stopped compressions. Stop, I said quietly. Everyone froze. The room went silent. The only sound was the monotonous beep of the monitor. The flat line alarm. I climbed off the bed. My legs were shaking. I pulled my stethoscope from around my neck, put it in my ears, listened to her chest. Silence. No heart sounds. I checked for a pulse. Carotid artery? Nothing. Femoral artery? Nothing. I pulled out my pen light. Checked her pupils. Fixed and dilated. 7 millimeters. Non-reactive. She was gone. I looked at the door. At Eleanor, standing outside, her hand over her mouth. I walked over, opened the door. Eleanor, I said softly. I'm so sorry. She collapsed, just collapsed, into a chair, her face in her hands, sobbing. I looked at the team. Time of death, I said, my voice flat, mechanical. 7:47 a.m., March 5th, 2023. I removed my gloves, slowly, methodically. Peeled them off, one finger at a time, dropped them in the trash. I'd performed this ritual 147 times in my career. This was number 148. The team started cleaning up, turning off monitors, removing IV lines, coiling up the defibrillator cables. Eleanor was still outside, sobbing into her hands. The nurse who'd been with her, Jessica, she walked over to me. Do you want me to call the chaplain? She asked quietly. I nodded. She left, and I just stood there, at the foot of the bed, staring at Alara Vaudreuil's body. Her eyes were still open, fixed, staring at nothing. I reached over, gently closed them, and I thought, this was the one I couldn't fix. The prophecy was wrong, or maybe it was right. Maybe this heart had fixed itself by stopping. I stood there for a long time. I don't know how long. The team had left. The room was quiet now. Just the soft hum of the ventilator in the next room, the distant beep of someone else's monitor, and me, standing over the body of a woman who told me 15 years ago that I'd one day face a heart I couldn't fix. She'd been right. I turned, and I walked out. There's a unique silence after a code is called. It's not true silence, not really. There are muffled sobs, the rustle of equipment being put away, the distant beep of other monitors in other rooms, someone's shoes squeaking on the linoleum floor. But it feels like silence, like the world has taken a breath and forgotten to exhale. I'm standing at the foot of the bed. Eleanor is outside in the hallway. I can hear her praying, quietly, her voice breaking. A nurse is at the computer workstation, documenting the time of death. Another is turning off the IV pumps, the soft click-click as they power down. The respiratory therapist is coiling up the ventilation bag. The resident is peeling off his gloves, and I'm just standing there, looking at Alara Vaudreuil's body, thinking I failed. I did everything right, everything by the book. The surgery was perfect, the valve was perfect, and she still died. This was the one I couldn't fix. I close my eyes, and I think about her words from 15 years ago. The heart that will teach you the most will be one you cannot fix. Well, she was right. I open my eyes, and I'm about to leave, about to walk out of this room and go talk to Eleanor, try to find some words that don't sound hollow, when I hear it. A beep. A single, sharp, electronic beep. From the cardiac monitor, the one we hadn't turned off yet. My first thought, artifact. Someone bumped the leads, or the monitor's glitching. It happens sometimes after a code. Electrical interference from all the shocks. But then it beeps again. I look up at the monitor, and I see it. A rhythm. Not the flat line I'd been staring at for the past 12 minutes. A rhythm. What the? I start, and then I stop. Because it's not just any rhythm. It's a normal rhythm. A perfect, regular, normal heart rhythm. I stare at the screen. Heart rate, 72 beats per minute. The rhythm is normal. Completely normal. A nurse, Sarah, she notices too. She looks up from the computer. Doctor, she says slowly, the leads must be, check them. I snap. She moves to the bed, checks the electrode pad stuck to Alara's chest. They're attached, she says, her voice uncertain. Properly. I look back at the monitor. The rhythm continues, regular, steady, normal. And then the blood pressure reading updates, 95/60. I blink. That's a blood pressure, a real blood pressure. It updates again, 105/65, then 110/70. I'm not breathing. I realize I'm not breathing. My chest is tight. My heart is pounding in my ears. This isn't possible. This is not medically, clinically, or physically possible. Dr. Rellian. Sarah's voice. Quiet. Shaking. I don't answer. I'm staring at the monitor. The rhythm is still there. Still normal. Heart rate, 75. Blood pressure, 115/72. Oxygen saturation, 96%. All normal. All impossible. Doctor, Sarah says again, louder this time. What's... And then Eleanor gasps. Not a sob. A gasp. Sharp. Shocked. I turn back to the bed, and I see it. Alara Vaudreuil's eyes. They're open, not dull, not clouded, not the fixed, glassy stare of a corpse. Clear, focused, alive. I can't move. I'm frozen. My brain is trying to process what I'm seeing, and it just can't. She takes a breath, a deep, shuddering, gasping breath. Her chest rises, falls, and then she takes another. Sarah drops the IV tray she's holding. It clatters to the floor, loud in the silence. No one moves. No one speaks. We're all just staring. Alara blinks. Once, twice. Her eyes move, scanning the room, taking us in. She sees me, locks eyes with me, and then she sits up. She sits up, not slowly, not groggily. She just sits up, like she's waking up from a nap. The room is frozen. The nurse, the resident, the respiratory therapist, me. No one moves. No one speaks. Alara looks around. Her gaze sweeps across the room, landing on each of us, and then she smiles, a small, knowing smile, like she's in on a joke the rest of us haven't figured out yet. "Dr. Rellian," she says. Her voice is hoarse, rough, like she's been screaming, but it's steady. "You did good work, but I told you, this heart fixes itself. I can't move. I'm a statue. My brain is screaming at me. This is impossible. This is medically, clinically, and physically impossible." She was dead. She'd been dead for 12 minutes. No pulse, no heartbeat, no breathing, pupils fixed and dilated. Dead. And now she's sitting up, talking, smiling. I start. My voice cracks. What? I can't form words. Eleanor rushes into the room. "Mama!" she shouts, and she's sobbing and laughing at the same time. "Mama, oh my God, Mama." She wraps her arms around Alara, buries her face in her mother's shoulder. Alara pats her back gently. "It's okay, baby," she says. "I'm okay." What happened?" Eleanor pulls back. Her face is streaked with tears. They said you were. "I was dead," Alara says, matter-of-factly, like she's commenting on the weather. Eleanor stares at her. "I know I was," Alara continues. "I was watching." "Mama, what are you?" Alara holds up a hand, gentle but firm. "Hush, baby. Let me tell them." She looks at me, and I swear to God, her eyes are clear, sharp, like she knows exactly what she's doing, exactly what she's saying. "Your compressions were good, doctor," she says. I blink. But on that last round, around minute 32, I think, they got a little shallow. "You were tired. It's okay. You're only human." My blood runs cold. How could she know that? She was dead. Her eyes were fixed, dilated. She had no pulse, no brain activity. How could she possibly know that? She turns, looks at Sarah. "And you," she says, pointing. "Sarah, is it?" Sarah nods. She's pale, shaking. "You almost forgot the second dose of medication," Alara says. "The one for the heart rhythm. I saw you reach for the adrenaline instead. But you caught yourself. Good job." Sarah's mouth falls open. I didn't tell anyone that," she whispers. "I didn't. How did you?" Alara just smiled. Then she looks at Eleanor. "Baby," she says gently, "you were praying the Hail Mary. Out. In the hallway." Eleanor nods. Tears were streaming down her face. "You messed up the words halfway through," Alara says. "You said now and at the hour of our death twice. It's okay. I heard you anyway." Eleanor's face crumples. "Mama, how do you know that?" I was there," Alara says simply. "I was watching." And then she turns back to me. Her eyes lock onto mine. "You were thinking about New Orleans," she says quietly. "About the reading I gave you 15 years ago?" I say nothing. I can't. My throat is closed. My chest is tight. "You were angry," she continues. You thought I was a fraud. A con artist? You still think I'm a fraud. I open my mouth, but no words come out. When you were 8 years old, she says, you broke your wrist falling out of a magnolia tree in your backyard. My heart stops. Your father, a plumber, not a doctor, he drove you to the emergency room. And while they were setting the bone, wrapping your arm in a cast, he looked at you and said, "Doctors fix what's broken. I'm not breathing." That's when you knew, Alara says. That's the moment you decided you wanted to be a surgeon. That's the memory you've carried with you your entire life. She pauses. And that's why you're angry now. Because you can't fix this with your hands. I stare at her. My mind is racing, spinning, trying to find an explanation, a rational explanation. But there isn't one, because I never told anyone that story. Not my ex-wife, not my colleagues, not my friends. No one. It was mine. A private memory I'd buried deep. And she just said it, out loud, like she'd been there. I whisper. How did you? I was dead, Dr. Rellian, she says softly. By every definition you know. No pulse, no breathing, no brain activity, dead. She pats the hospital bed. But God told me it wasn't my time. He said you still had more to learn. So he sent me back. She smiles, that same knowing smile. This heart fixed itself, just like I said it would. The room is silent. No one moves. No one speaks. We're all just staring at her. This 87-year-old woman who was dead 12 minutes ago and is now sitting up in bed, talking, smiling, telling us things she shouldn't know. Couldn't know. Sarah breaks the silence. I need to get the doctor, she stammers. I need to call someone. I'm right here, I say quietly. But I don't know what to do. I don't know what to think. Because everything I know, everything I've built my career on, everything I've believed for the past 20 years, it's all just shattered. The binary doesn't exist. Dead isn't final. And I have absolutely no idea what's real anymore. The first thing I did, after I stopped standing there like an idiot, was order tests. Every test. I need a CT of her head, I said. My voice was shaky. Stat, and an EKG, echo, blood gas, full metabolic panel, cardiac enzymes, everything. The team moved, because that's what we do. Something impossible happens, and we fall back on protocol, on science, on data. If she's alive, and she clearly is alive, then I need to know how alive. I need to understand what just happened, even though I already know I won't. For the next 48 hours, I didn't sleep. I ran every test known to modern medicine. Brain imaging, heart imaging, blood work, neurological exams. I called in consultants, neurologists, cardiologists, even a psychiatrist, though I didn't tell him why. Because here's the thing. Alara had been without a pulse for over 30 minutes. 30 minutes. No blood flow to the brain. No oxygen. After just 4 to 6 minutes without oxygen, brain cells start to die. Permanent damage. That's why we move so fast during a code. Because time is brain tissue. After 10 minutes, severe brain damage. Vegetative state. If you survive at all. After 30 minutes, you're gone. Even if we get your heart started again, not you anymore. You're a body with no one home. That's a science. That's what I was taught. That's what I've seen in hundreds of patients. And yet, Alara Vaudreuil was sitting up in bed, talking, smiling, eating a turkey sandwich that Eleanor brought from the cafeteria. So I needed answers. The results. They came back over the next 24 hours. The brain MRI first. I pulled it up on my computer, stared at the images. No damage. None. No signs of oxygen deprivation, no areas of dead tissue, no swelling, no bleeding. It was a completely normal brain MRI. I called the radiologist. "Are you sure these are the right images?" I asked. "Dr. Rellian, I triple-checked. That's Alara Vaudreuil. Date of birth matches. Medical record number matches. But she coded for 35 minutes. There should be—" "I know what the chart says," he interrupted. "But I'm telling you, there's no evidence of oxygen deprivation. None. Her brain looks perfect." I hung up, stared at the screen. Perfect. The echocardiogram was next. Her heart. The thing that had stopped, that had been in chaotic, useless rhythms for half an hour. I watched the video. The ultrasound images of her heart beating. Ejection fraction, 60%. That's the percentage of blood the heart pumps out with each beat. Normal is 55% to 70%. Hers was 60%. Better than before the surgery. The valve I'd implanted, perfectly seated. Functioning beautifully. No leaks, no problems. And the heart muscle itself. No damage, no scarring, no signs of the prolonged cardiac arrest. It was like the code never happened. The neurological exam, I did it myself. Twice. "Mrs. Vaudreuil, can you tell me your full name?" "Alara Marie Vaudreuil." "And what's today's date?" "March 7th, 2023. "Where are we right now?" "We're in the hospital, the ICU. Room 8, I think." "Who's the president?" She smiled. "Joe Biden, though I didn't vote for him." I asked her to remember 3 words: apple, table, penny. 5 minutes later, I asked her to repeat them. "Apple, table, penny," she said without hesitation. I had her follow my finger with her eyes, squeeze my hands, push against my palms with her feet, full strength, all extremities, reflexes normal, speech clear. I stood back. "How do you feel?" I asked. "Tired," she said, "but good. Better than I have in years, honestly." And then, I swear this is true, she got up, walked to the bathroom. Unassisted, no walker, no wheelchair, just walked, like nothing had happened. The blood work came back. Cardiac enzymes, the markers that show heart damage, were mildly elevated. But that was consistent with CPR, with the chest compressions, the broken ribs. But they were already trending down. Her kidney function, normal. Liver function, normal. Lactate, the marker for oxygen deprivation in tissues, normal. Everything was normal. No, better than normal. She was pristine. She hadn't just survived. She'd been healed. I sat in my office that night. 2 a.m. drinking cold coffee, scrolling through medical journals on my computer, looking for an explanation. And I found one. Sort of. Lazarus syndrome. It's a real thing. A documented phenomenon. Spontaneous return of circulation after CPR is stopped. It's rare. Very rare. But it happens. The theory is that after you stop compressions, the pressure inside the chest normalizes. And sometimes, that allows the heart to restart on its own. Most cases happen within 2 to 3 minutes after stopping CPR. The longest documented case? 10 minutes. Alara's heart restarted 12 minutes after I called the time of death. Close enough, right? Except, patients who experience Lazarus syndrome, they don't wake up and start talking. They're unconscious, on life support, with severe brain damage. They're not walking to the bathroom and eating turkey sandwiches. And they're certainly not recounting specific details of the resuscitation with perfect accuracy. So, this wasn't Lazarus syndrome. This was something else. Something I didn't have a name for. 1 week later, Wednesday, 7 a.m., the surgical department's morbidity and mortality conference. We call it M&M. Every week we present cases where things went wrong, or rarely, where things went inexplicably right. I was scheduled to present. The conference room was packed. 30, maybe 40 doctors, surgeons, residents, medical students, all with their coffee and their notepads. I stood at the front, pulled up the PowerPoint I'd made. First slide. Patient. Ilara Vaudreuil, 87, TAVR, complicated by cardiac arrest. I walked them through the case. The valve replacement, the textbook surgery, the perfect post-op recovery, and then the crash. Post-op day 2, I said, clicking to the next slide. Patient became obtunded. Vitals deteriorated rapidly. She went into VTAC, then VFib. We ran a full code. 35 minutes of CPR, 8 shocks, 6 rounds of epi, 3 rounds of amiodarone. I paused. At 7:47 a.m., I called the time of death. The room was silent, listening. I clicked to the next slide. It was blank except for one sentence. 12 minutes later, the patient woke up. I let that sit for a moment. 12 minutes after I pronounced her dead, I said slowly. Her heart restarted, spontaneously. She regained consciousness, sat up, spoke, and walked to the bathroom later that day. Silence. And then the questions started. Dr. Patel, one of the anesthesiologists, raised his hand. Marcus, he said carefully, are you sure she was actually dead? Could it have been a very weak pulse that you missed? I shook my head. Her pupils were fixed and dilated, 7 millimeters. No pulse for 35 minutes. I checked carotid and femoral. Flat line on the monitor. She was dead, Raj. Dr. Morrison, a cardiologist, spoke up next. Delayed return of spontaneous circulation, he said. It's rare, but it happens. Lazarus syndrome. Not 12 minutes delayed, I said, and not with zero neurological deficit. She had no brain damage, none. More murmurs. Dr. Kim, the chief of medicine, leaned forward. Marcus, she said gently, you saved her. This is a miracle of modern medicine. You should be proud. This is the kind of case we write up for journals. I looked at her, and I said, very quietly, I didn't save her, Christine. The room went still. I couldn't save her, I continued. I did everything right, everything by the book, and she still died. She was gone for 12 minutes. I pronounced her. I documented it. I paused. She saved herself. Long silence. I could see it on their faces. The uncomfortable looks, the sideways glances. They thought I was having a breakdown. Maybe I was. 2 days after the code, Ilara was being discharged. I had no medical reason to keep her. Every test was normal. She was stable, healthy. Healthier than before the surgery, even. So she was going home. I went to her room before she left. Eleanor was there, packing up her mother's things, folding clothes, gathering the get well cards that had been taped to the wall. Ilara was dressed, sitting in the chair by the window, looking out at the parking lot. She turned when I walked in, smiled. Dr. Rellian, she said, come to say goodbye? Something like that, I said. Eleanor gave us a look, then quietly excused herself. I'll go get the car, she said. And then it was just the two of us. I sat down in the other chair. For a long moment, neither of us spoke. And then I said, Mrs. Vaudreuil, I need to ask you something. She nodded. I know. What was it like? I asked. Being dead. She looked at me, her eyes soft, kind. It was peaceful, doctor, she said quietly. Quiet. I wasn't scared. She paused. I saw my husband, James. He's been gone almost 20 years now. But he was there, young, smiling, like the day we got married. I saw my mother, my grandmother, people I loved who passed on. And I saw a light, I suppose, very bright, very warm. It felt like home. I didn't interrupt, just listened. And then I heard a voice, she continued. Not out loud, not like you and I are talking. It was inside, in my head. Or my heart, I don't know. What did it say? I asked. She smiled. It said, not yet. He needs to learn. Go back. A chill ran down my spine. So I did, she said simply. I came back. I stared at her. Why me? I asked, my voice barely a whisper. Why did I need to learn? She reached over, took my hand, the same hand she'd read 15 years ago. Because, Dr. Rellian, she said gently, you've spent 20 years fixing hearts. You're very good at it. One of the best. She squeezed my hand. But you've never let yourself feel with one. I opened my mouth to respond, but she kept talking. You've built walls around your heart, around yourself. You see patients as problems to solve, bodies to fix. You don't see the people. That's not, the work isn't done, she said, cutting me off. Yours or mine. She let go of my hand, patted it once, but it will be. When you're ready. Eleanor came back in. Car's out front, Mama. Ilara stood, steady on her feet. She looked at me one more time. Thank you, Dr. Rellian, she said, for everything. And then she walked out. I tried to go back to normal. I really did. I scrubbed in for surgeries. I saw patients in the clinic. I did rounds. But every time I held a scalpel, every time I clamped an aorta, I thought about her, about what she said. This heart fixes itself. How do you go back to being a mechanic after that? How do you look at a patient and see just a broken valve when you've seen a woman die and come back to life? How do you call a time of death when you've watched someone wake up 12 minutes later? I couldn't. Every code I ran after March 5th, I'd wait. I'd stand there, staring at the flat line, waiting for the beep, waiting for the miracle. It never came. Not for anyone else. My team started to notice. Dr. Rellian, a resident would say, we've been running this for 30 minutes. Should we call it? And I'd say, wait, just wait. Sir, there's no rhythm, no pulse. I said, wait. They'd look at each other, uncomfortable, confused. But they'd keep going, because I was the chief. And you don't question the chief. But I could see it in their eyes. They thought I was breaking down, and maybe I was. I started second-guessing everything. A patient would code, and I'd think, am I doing enough? Am I giving up too soon? What if they come back? I couldn't trust myself anymore. And a surgeon who can't trust himself, that's dangerous. That's how people die. September 2023. 6 months after Ilara Vaudreuil walked out of the hospital, I walked into the Chief of Medicine's office. Dr. Christine Kim looked up from her desk. Marcus, she said, surprised. I didn't have you on my schedule. I know, I said. This won't take long. I sat down, and I said, I'm resigning as Chief of Cardiothoracic Surgery. She stared at me. What? I'm stepping down, effective immediately. Marcus, what? Why? You're at the top of your field. Your outcomes are incredible. Your patients love you. I shook my head. I can't do it anymore, Christine. Can't do what? I didn't answer. Because how could I explain? How could I say, I no longer believe in the binary? I've seen the third option. I watched a woman die and then watched her come back, and now I don't know what death even means. I couldn't. So I just said, I need to step away from surgery. I need a break. She studied me for a long moment. All right, she said finally, if that's what you need. But Marcus, are you okay? I don't know, I said honestly. They offered me a position teaching at the medical school, a quiet academic post, lecturing, mentoring students, no surgeries, no life or death decisions, no codes. I took it, and I haven't operated since. October 2024. 18 months after everything happened, I was in New Orleans for a medical conference, giving a talk on surgical ethics. Ironic, right? I had an afternoon free, and I found myself walking through the French Quarter, down side streets, past shops and restaurants and bars with jazz music spilling out onto the sidewalk. I wasn't sure where I was going until I saw the sign. Vaudreuil card readings. By appointment. The same shop, the same hand-painted letters. I stood there for a long time, just staring at it. And then I knocked. A voice called out from inside. Her voice. "Come in, Dr. Rellian. I've been expecting you." I pushed open the door. The shop was small, dim, lit by candles and a small lamp in the corner. It smelled like incense and old wood. Velvet curtains hung on the walls, and in the center of the room was a small table with a deck of cards. Elara sat across from me. She looked exactly the same, maybe a little older, but her eyes, sharp, dark, knowing, were the same. She smiled. "I knew you'd come," she said. I didn't move from the doorway. "I don't know why I'm here," I said. "Yes, you do," she said gently. "Sit." I sat. She picked up the deck of cards, started shuffling. Her hands were steady, practiced. "Ask your question," she said. "Out loud or in your head. Doesn't matter. I'll hear it." I thought, what am I supposed to do now? She laid out 3 cards, face down, and then she flipped the first one. The tower, reversed. "The tower," she said, but reversed. "The collapse has already happened, Doctor. Your old world, the one built on certainty, on control, it's gone. Destroyed." She tapped the card. "But you're still standing in the rubble. Afraid to leave. Afraid to rebuild." She flipped the second card. "The hermit." "The hermit," she said. "You've withdrawn, gone inward, teaching instead of doing, thinking instead of feeling." She looked at me. "You're searching for answers in books, in journals, in data. But the answer isn't in a book, Dr. Rellian." She flipped the third card. "The star." "The star," she said softly. "Hope, healing. But not the kind you're used to. Not with a scalpel, not with your hands." She paused. "This is healing through presence, through connection, through being, not doing." She gathered the cards, set them aside. "You held my heart once, Dr. Rellian," she said. "You held it in your hands. Literally, you fixed the valve." She placed her hand over her chest. But the heart that fixed itself wasn't the valve. It was me. My whole heart. My spirit, my soul, whatever you want to call it. She looked at me. "And now it's your turn." "How?" I asked. My voice cracked. "I don't know how to do that." "You start by forgiving yourself," she said. "For what?" "For being human. For not having all the answers. For thinking you were God." I looked away. "Your hands are still good hands, Doctor," she said. "But they don't need to hold scalpels to heal." She leaned forward. "They can hold a student's shoulder when they're struggling. They can hold space for a patient's fear. They can hold your own heart and let it break a little." She smiled. "The surgeon died on March 5th. I know, I was there." A pause. "But something else was born that day. Something more. And I'm giving you permission to let go of who you were and become who you're meant to be." I left the shop, and I walked. For hours. Through the French Quarter, past Jackson Square, along the river. I thought about what she said. About forgiveness. About being human. About letting my heart break. And for the first time in 18 months, I cried. I still don't believe in card readings. I don't believe in the supernatural, in ghosts or spirits or divine intervention. But I believe in what I saw. And that's the most terrifying thing of all. Because if I'm right, if Alara Vaudroy truly died and came back, then everything I built my life on was a comfortable lie. The binary doesn't exist. Dead isn't final. The certainty I clung to for 20 years was an illusion. And if I'm wrong, if there's some medical explanation I'm missing, some variable I didn't account for, then I'm a man of science who can no longer trust his own eyes, his own hands, his own judgment. Either way, the surgeon died that day. The one who thought he was God, the one who believed he could fix anything. And I don't know what I am now, but I'm teaching a new generation of doctors, medical students, residents, and I tell them this: medicine is not a science of certainty. It's a practice of humility. You will see things you cannot explain. You will encounter mysteries that textbooks don't cover. Patients who survive when they shouldn't. Patients who die when they shouldn't. And when that happens, do not cling to your certainty. Let it go. Because the moment you think you know everything is the moment you stop being a healer. Alara Vaudroy is still alive, still doing readings in that little shop in New Orleans. I know because she sends me a card every year, on March 5th. It's always the same card. The Fool, the card of new beginnings. I keep them all. The impossible thing I witnessed that day still haunts me. Not because I can't explain it, but because I can't unsee it. I can't go back to the comfortable lie of certainty. I can't pretend the binary exists anymore. And maybe that's the point. Maybe that's what she meant when she said I had more to learn. Maybe the lesson wasn't about death, it was about life, about being human, about letting go of control and embracing the mystery. I don't know. But every year, on March 5th, when that card arrives in the mail, I think about her. And I think about that moment, 12 minutes after I called time of death, when the impossible happened, and everything I knew changed.